Hi, Professor Tashonda Holland and Olivia here. Say hi.
Hi.
So we actually have the consent form printed out. She's going to come over here. She is actively initially as I read her the boxes. Um, First, I consent to video, audio recordings being made of mock sessions into these recordings being used to aid in growth of social worker knowledge and skills.
I do.
I consent to the excerpts from these recordings or descriptions of them being used by Grand Canyon University faculty and staff for the purpose of supervision, research, and or teaching.
Yep.
I understand that any part of a conversation that is recorded and or written down will be kept anonymous.
Yep.
I will not disclose any information that may identify me in the mock session recordings. The information given will be fictional and I will use an alias.
I do.
I understand that Zoom will be used to record social work sessions and that Zoom meets both HIPAA and FERPA confidentiality standards.
Yep.
I understand that if the recording of the mock session activates any suicidal ideation or other potentially harmful thoughts, I will reach out to a professional in my area immediately.
Most definitely.
Neither GCU, the college, nor the social work student will be held accountable if I harm myself. Do you agree?
Yep.
Okay, she has initialed and signed the agreement. Okay, we are starting our session now. Hi, Grace. I'm Tashonda. I'm going to be your therapist today. I'm so glad that you came in today. Before we get started, I just want to share a few things with you first. First of all, I just want you to understand that this is a safe environment for you to come in and be able to share anything that you need to share with me. You'll learn that as we go further along in our therapy and get to know each other better. Also, I just wanted to point out that everything that is said here is it's confidential, except for if you speak on harming yourself or other people. So let's start on how things have been since the last session. Last time you mentioned you were feeling stuck in your addiction, and you wanted to make some changes. Do you still feel that way? And what are you hoping to get out of this session today?
Um, well, first of all, I'm hoping to get like a little more uh information and advice on how to move forward and getting sober, but um I definitely do feel the same way. I've been trying to stop drinking, but it never lasts. Like I'll last a couple days or a couple weeks and then something triggers me and I just go right back to it. Um It's the only coping skill that I know.
It's going back to using.
Yeah.
Okay. So, I know that can be extremely frustrating. So let's dig in a little bit deeper. So what do you think is getting in the way of you stopping using for good? And if you could picture life, without it, like what would life look like for Grace without any substances?
Like I said before, I feel like the main thing that's getting in the way of stopping me is I just don't have any other, I've never been taught any other way to deal with life. I mean, you know, so, but without alcohol, life would be a lot better. It'd be a lot more peaceful. And, um, I wouldn't be as much of a burden on my family and friends. And I don't know, I've just been doing it for so long. I don't really know who I would be without it. It's such a huge part of who I am.
Yeah. Um, so kind of what I hear you saying is that using has kind of been your norm.
Yeah.
It's your only way of life. You've known how to live for a long time. And I can get how that can be extremely frustrating. There was one point I'm also in recovery. I've been sober for 10 years now. And there was one point in my life too where I couldn't picture life or even just one day without using. Like that was really scary for me. I used drugs and alcohol in order, like you said, to cope with whatever was going on in my life, any negative feelings or situations. Um, And to think about not having that to cope with those feelings and having to sit with them, it was scary for me. So I can see where you're coming from. So let's talk more about fear. What do you think living without the substances? Why do you think that is so scary for you? What would you like? What would you like? What do you think you could do to not have to rely on that more?
I don't know. Like it's so scary because like what if I get sober for a while and start to get my life back and then uh I turn to drinking again when life gets hard and I let everyone down. Like that's probably my biggest fear is just disappointing everyone all over again. Um I don't know. I can't really picture what it would be like to not rely on it anymore, but I know it would be nice to not have to. I feel
Yeah.
like it would be easier.
You think it would be easier?
Yeah.
Um, so I kind of hear you saying that you have a fear of letting other people down, right?
Hmm.
Which you feel like if you were to start getting sober and then you use again, you would let them down.
Hmm.
So in order to not even face that, you just go ahead and use anyways,
Yeah, because
right?
I've already disappointed them up to like the damage is done up to this point.
Okay.
So like, what if I repair it and then let them down all over again? It's like double the damage.
Yeah, those are very valid fears, but I feel like you're not giving your chance at sobriety. So let's do a check to kind of like see where you're at. So have you ever heard of the stages of change model?
No.
Okay, so I actually printed you your own little copy out.
Okay.
So this is a model that kind of tells you where you're at in recovery or if you're even in recovery. So the first stage is going to be the pre-contemplation stage. This stage is you don't acknowledge that you have an issue, or maybe you do not acknowledge you have an issue, but you don't feel like it's a problem for you. The next one would be contemplation stage. And this is where you recognize that you have a problem, but you're unsure if you really want to do anything about it. If you want to take any action towards recovery. The next one is preparation. It's intent of taking action. In this step, you may be looking into possible 12-step programs, maybe an outpatient program, inpatient program, whatever you think would help you. And then the next stage is the action. This is where you're actually taking steps, like you're actively going to meetings, you're enrolled in ILT, and you're going into classes, or maybe you're in a outpatient or inpatient rehab. Stop. The next one is maintenance. So the maintenance is basically you're sustaining your recovery, and you're this is where the change really occurs, and you're continuing going to meetings, and maybe now you have a sponsor, you're doing everything you can to back up all the action that you have so that you stay moving forward. Um, so now that you've kind of taken, we went over the stages of change. Where do you think you're at in your journey on the stages of change model?
I feel like based off what you just explained, I'm like right in between contemplation and preparation. Um, like I think about making the change all the time. Like I'm sick and tired of being sick and tired, and I just I want to change, but
Sorry, it's my support animal.
I want to change, but I just don't know how, and I also don't have a lot of confidence in myself to do it.
Okay. Um, So the contemplation and the preparation stages, it's a really good stage to be in. It shows that you're not ignoring the problem anymore. Like you see that there's a problem. And you're starting to think about how to make your changes. I mean, you may not know yourself on how to change, but you're actually reaching out. For example, you're coming to therapy and you're doing the things that you need to do to actually start making some changes. So what do you think you need to move from thinking about the preparation to make those changes? What are you gonna do to prepare?
Well, I guess I just need someone to like kind of guide me through what I'm supposed to do and how to do it, and mainly like help give me the confidence when I don't have it in myself, or
Mm,
teach me how to have that same confidence in myself. So like a support system of some sort.
yeah. You don't think you can do it on your own? None of us can do it on our own. We were intended to do things on our own. And there's actually more resources out there. Reese's pieces of it. Resources out there more than you think. There's a lot of people out there that's willing and ready and passionate about helping. Um, so support is definitely important. And we can talk about different ways on to build that support. Whether it's through a 12-step meeting, there's CA, there's NA, there's AA, there's meeting groups, there's like your family can even be a part of that, or even me. And it's okay to need help in this process. One of the things that I teach my other clients is coping skills. And the number one coping skill is asking for help. And it's actually one of the hardest steps to do, but you're showing that today. So as we wrap up today's session, I'm hearing that you've made some progress in understanding your challenges. You're not exactly where you want to be, but you're seeing what needs to be done to get to where you actually want to be. And that's a huge step. First of all, I want to commend you just for coming in today. It's hard to admit that we have issues or that we have a problem and ask for help on that. It's very vulnerable. It's very scary, and it's also very brave. Um, so how do you feel about that? How do you feel about you coming in today and asking for help?
Um, I mean, it was a big step for me because I've just never really cared about getting out of the cycle, but I've kind of lost everything and everyone I care about. So, um, kind of like hit rock bottom and just need to find a way out. So I feel good about the therapy, and I feel like I've made some progress in it.
Good,
So
good. It's important to be able to see your own progress. And I will definitely point out progress that I see in you. That's me supporting you. And I just want you to know that this session is all these sessions is about you. It's not about what I think you need. It's about you telling me what you want your life to look like, and I'm going to support you and help you get there the best to my ability. And remember that the goal isn't to change everything at once. We must make smaller steps in order to make bigger steps. So we'll start out slowly by making small goals. Like maybe a first goal would be, just showing up every week. And so you can have some trust within me to be able to trust that you can talk to me about things you need to talk about and help you, reach your goals. So in order to reach bigger goals, we have to start with small ones. It builds our confidence in order to actually reach the big ones. And it keeps you from getting overwhelmed. So we'll start working on smaller steps and goals and then start working on bigger ones. Um, so next time let's talk more about because one of the things that you mentioned is that you want a bigger support group. You want more support. So the next time that you come in for your session, we'll get a little bit deeper in where you can find your support from. And if you feel comfortable today, I can actually print you out local meetings list for NAAA and all those different types of 12-step meetings. If you're comfortable, it's completely up to you. This is your journey at your own pace. Pace. It's your own pace. Okay. So, but it's gonna be there for you. Does that sound good?
yeah, I mean, I'm definitely interested in any information you have on meetings. I think it's something that would make me realize that I'm not the only one going through this, and
Yeah.
um, so, and I guess I'll just start thinking of the different types of support that I could possibly need for myself, other than 12 step or a group.
Perfect. Perfect. So, you're doing great by just showing up. and being open. One of the most important and key aspects of successful therapy session is open and honesty. Um, I meet you where you're at. Okay. So in order for me to know where you're at, you have to tell me. You have to be willing and trust me enough. We'll get there. But you trust me enough where you can actually tell me that what you need, what you're struggling with, and how I can help you. Um, so next time, I'll see you next time. And we'll take it from there. So I'm so glad that you came in today, Grace, and I hope you have a wonderful day. This ends our session. Um, I don't even know. I feel like I listened to her. I had good stance. Um, definitely use active listening, made eye contact. I think I had good body language. I have to really look at the video. I haven't looked at it yet. Let me see. I use client-centered approach. I allowed her to express her feelings. I allowed her to express what she wants out of therapy, what her goals may be. Use motivational interviewing. I thought it was important for her to be able to explore her own thoughts about change. Um, Let me see my weaknesses. I could have pushed the clients a little bit more to be more specific on measurable goals, most definitely. Um, I didn't really express a whole lot of coping strategies, which I probably could have got a little bit deeper in that. I mean, I did a little bit, but we probably could have done taught her some breathing exercises or some grounding techniques until the next therapy session. Um, let me see. Okay, so she kept talking about support system and how she wanted it. I probably could have got a little deeper into what support system she has now, and how they support her in what ways. Um, yeah, probably should have done that. And then her and I talked about goals. We talked about smaller goals, needing to work on smaller goals in order to have the confidence for bigger goals. We could have talked a little bit more about maybe specific goals. I think I did mention something about starting a small goal of actually just showing up every week. Maybe we could have done a few more smaller goals together. I think next time I'll start the session out by asking her how her week was, if she had any triggers, if she used any healthy coping skills, and what she did and how her thoughts, her feelings, and her emotions were behind those. Um, I think I did pretty decent. I don't know. Hope you liked it. Bye.